I'm Brenda Chaga, a student nurse third year at Damm School of Nursing, Matibabu.
I'm Judith Mora. I'm also a third year student at Damm School of Nursing. And today we are going to perform resuscitation of an infant. So to begin, resuscitation is a series of events that are established to initiate breathing, to maintain the skin color of a baby, the tone, and activity in cases of babies that do not initiate breathing when they are born. So indications, of course, when the baby is delivered and they do not initiate breathing at birth, or if a baby is born, breathes spontaneously, but later develops asphyxia. So we can do resuscitation, like I've said. Number one, if the baby does not initiate breathing, the baby breathes, but in due time they stops breathing. And the third thing, we can do resuscitation when a baby scores less than 6 on an APGAR score. An APGAR score is a test that is done for a baby during birth, and A is for the appearance of the baby. The baby normally should be pink in color. So if the baby has bluish extremities or is blue, we score them differently. And then we have a G for grimace. If the baby shows any grimace on the face, maybe because of the change of environment, from home environment to external environment. The other A we have is for activity. If the baby moves the body, for example, when you hold the baby, they move the hands and the feet. Then R
is for the respirations. So you're going to observe if there are possible respiration to the baby before you start doing resuscitation. So, as we have been told, I'm going to do the resuscitation to our baby. So I'm going to check for the environment. Of course, I've put on the resuscitator to ensure that the temperature where I'm going to resuscitate my baby is okay, because it will need some of it will require me to expose the baby just for my procedure purposes. So I will start by cleaning my hands. Then to my baby, I will start by assessing the baby. So in my assessment, I'm going to look for the color, any activity, as we have been told, just concerning the APGAR score. So I will start by clearing the airway. On the airway clearance, I'm going to observe if there are any secretions in the baby's nose and mouth. Then I will sanction them just to establish the airway. So I will first of all hold the baby here, then I will tilt just to open the airway this way. Then I will now sanction the secretions. If there are secretions in the mouth, I will also sanction. Then I will check for any breathing of the baby. Of course, I will have to expose the baby a little bit. Then I will check for the pulse. The pulse will be checked at the apex beat of the child. In 1 minute, I will count. Okay. If the child is not speaking, I will give 5 rescue breaths to the baby. So I will put my ampule bag, position it well as I observe the chest, then give 5 rescue breaths. 1, 2, 3, 4, 5. If the baby is not speaking, I will use the chest compressions. That way I'm going to give 5 chest compressions, 15 chest compressions, I'm sorry. Then I'll give 2 rescue breaths. So I'm going to position my baby. Then I'll ensure the airway is okay. So I'm going to hold just at the sternum with my thumbs. Then I'll use the other parts of the arms to support. So I'll start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Then I will ask my assistant to give the 2 rescue breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Rescue breaths, please. So if the baby is not speaking, we are going.
If the baby does not speak after resuscitation, with the drugs that we administer sodium bicarbonate to prevent acidosis. We also administer 5% dextrose. We can administer it through the umbilical vein, and it is to prevent hypoglycemia.
Yeah.
So in our case, we do not have the drugs, so we cannot administer them. But once the baby has peaked, we ensure that the baby is still on oxygen. Then we take the baby to the incubator.
Yes. So I'm going to take the baby to the incubator. Thank you.